So I had this patient, right? Finally, and he was having a whole bunch of sacroiliac joint pain. And the sacroiliac joint is just this one in the back of the pelvis here. Taking a look at more of an anatomic model, the sacroiliac joint is between the sacrum, this vaguely triangular bone right here, and the innominate, or the iliac portion of that innominate right about here. Between the two of them, the sacrum and the ilium, they make the sacroiliac joint. What was particularly interesting about this patient is that he was having this pain, he was having all these lightning bolts shooting out of it from cycling, bicycling. So when that foot was going around and around on the apparently non-existent pedal in this particular picture, as it was going around in this circle, that's when the pain occurred. And what was even more interesting is that it wasn't in other situations. It was specific to the bicycle, but walking, a little bit of running, going up the stairs, that did not create the problem at all, which is neat, which needs to be investigated, which means you got to look at some stuff. In any case, the bike poses an interesting problem or an interesting situation. You have to understand that as that pedal or that foot is bringing that pedal around, the whole leg is moving, all of it is moving, the knee, the ankle, all the way up into that hip. And so it carries through the leg into the innominate. So going back to this anatomic model, we have an ascending and descending forces going into that innominate, because that hip joint attaches right into it, and it's got a number of different muscles and ligaments that are going to pull from the hip or the femur into that innominate. And so that means that we have pull going backwards and forwards on that innominate. Now, the sacroiliac joint is a joint. It does move. It's in fact a synovial joint, and it has a whole lot of ligaments crossing it. So it tends to get very sensitive. It can be one of the more painful joints if you've ever experienced. You would agree with me. And we tend to think of that sacroiliac joint as nutation and counternutation, or sacral motion. Nodding forward of the sacrum, even though it's only a few millimeters, we call it nutation. Nodding backwards of that sacrum, we call that counternutation. Again, only a few millimeters, but it does happen. And this means that, guess what? That innominate, and this will be both sides, of course, can move backwards and forwards. We happen to call that an anterior and posterior motion, naming it essentially from the top. So there's some movement through there. Now, when we throw in a bike seat, this gets real interesting, because when you throw in a bike seat, it tends to be right on the sacrum, and that means that the sacrum is being held in place, or at least partially wedged, by that bike seat. That means it's a fixed point. It's not moving. It's not doing anything. So it's going to stay right there. Now, normally, anyone with a normal working SI joint, any person who's essentially free of injury, should have no pain when riding a bike. This is not an anti-bike video, by the way. Pro-bike right here. But this particular patient, the plot thickens, was going through a process of treatment in which it was softening that sacroiliac joint, where it was rigid before, and now that sacroiliac joint was gradually loosening and softening. Not perfect, but getting better. And so because of the fact that the bicycle seat isolated the sacrum from the innominate, and because the movement of riding the bike, of pedaling the bike, moved that innominate on the sacrum, it started to stimulate and mobilize those tissues that were not created in other motions. Again, walking, running, going up the stairs, maybe even yoga, would not get the same effect. But because of the specific mechanics of riding a bike, it took on the motion necessary to target that specific joint. And that's not against biking. There's nothing wrong with biking. It just means it wasn't the right thing at the right time. As soon as that sacroiliac joint starts moving again much more normally, everything's going to be fine. And everything is going to be a lot better, which is great. Time is a factor.